You're very welcome to today's lunchtime webinar as part of Health Literacy UK Month. We are delighted to welcome two of the founding members of the Health Literacy UK group, Dr. Evelyn McElhinney and Professor Joanne Protheroe. So they will be speaking today on building health literacy skills with health professionals. The first part of the webinar will be the presentation by Evelyn and Joe, and then there will be an opportunity for any questions that you have. If as you're going along you have a question, you're welcome to add it to the chat, or afterwards you can unmute and ask the question yourself. You're very welcome to do whichever suits you best. We would ask that cameras are off and you stay muted just during the presentation, but after that you're welcome to join the session. The session is being recorded and will be made available on the Health Literacy UK website following the webinar series. So this is our second of the month, so we're delighted to have you join with us. So today we welcome Dr. Evelyn McElhinney, who is a senior lecturer in nursing and community health development of Glasgow's Caledonian School of Health and Life Sciences, and program leader for the Masters in Nursing Advanced Professional Practice, which includes the pathway for advanced nurse practitioners. Evelyn is currently the chair of Health Literacy UK and an active member of the International Union of Health Promotion and Education Health Literacy Steering Group. Evelyn has an interest in digital health and emerging immersive technology for health and well-being, and is published in peer-reviewed journals, advised on health literacy policy, and presented at national and international conferences on health literacy and digital health. So you're very welcome, Evelyn. Professor Joanne Protheroe. Joe has been a practicing general practitioner for over 20 years and has worked in various academic and research capacities before being appointed as Professor of General Practice in Keele Medical School in 2017. She leads the academic primary care team, is director of the undergraduate general practice, and is director of integrated clinical academic training for Keele. And she continues to practice as a GP in an inner city practice as well. Joe is a founding member of Health Literacy UK and the research lead for the group. So very experienced presenters we have with us today. And I think the developing skills for health professionals is always a keen topic. So we look forward to your presentation and encourage you to add comments and questions to the chat, and we can pick those up afterwards. So please go ahead and share your presentation. Thank you.
Hi, thanks everybody. So probably first to say is that although we're going to talk about some of the stuff that Joe and I do, certainly in GCU, and I'm sure it's the same in Keele, there's a number of health literacy champions across the faculty, and they may do even other things that we don't mention today, but the principles are pretty much the same. And we're happy during or after it to see any of your own suggestions or anything that you do as well, especially in health care practitioners, because it's great to just build the resources as we go along. So I'm just sorry, I just need to shut down my Teams, I forgot, because that will just keep popping up every 2 minutes as well. Thanks for that. So we'll move on. So let me just check.
The slides aren't showing yet.
Yeah. Okay. Have they disappeared? They were sharing. No, they're not sharing. Okay.
They're not sharing now.
Share my screen again. Sorry about that. Why that stopped sharing. Okay. Yeah. That is now.
Yep.
Sorry about that. Now I just need to get this thing. We've checked all this, of course, 2 minutes ago when it was working perfectly, and now it's deciding not to move on when I press. Yeah, there we go. Okay, so there has been quite a recent systematic review by Keele et al. And who across 8 different countries, and they looked at health literacy in university students. Now, this wasn't just in healthcare students, however, there was a number of healthcare, nursing and medical students included in this. But as you can see by their findings here, that there's been quite a lot of evidence that their own health literacy was actually fairly poor, and that could be influenced by a number of things, their age or their gender. The stage of degree was quite interesting as well, because it's certainly got better in healthcare practitioners as years goes on, but they didn't find an awful lot of difference in other specialties. So there is, still quite a bit of evidence across health literacy in university students that ORCAN has been doing as well. So there's a lot of recent papers coming out showing that, there's not always great health literacy in students, and especially even in our own health students. So some of the things that we try to do, when I started looking at this probably about 8 years ago, or maybe slightly longer, the Health Literacy Scotland Action Plan I started to get involved in because I was looking at health literacy for a PhD. And at that time, when I was just talking to students, undergrad or postgrad, so when I say postgrad in this presentation, I mean post-registration, as in they're already registered nurses or registered allied health practitioners who are working and then coming back to university to study. So when I discussed health literacy and what was health literacy, there was very few hands, because it was very much face-to-face at that time, very few hands went up. So, or there was a mix of ideas around what health literacy meant that was very much just a definition of health promotion. And as you know, it is slightly different, although it contributes obviously to health promotion. Now that is different. So one of our key aims that we try is to make sure that we improve our understanding of health literacy firstly, and that their understanding around the definitions, that what we mean by functional, so more patient, provider, reading, writing, etc. And then our more idea around public health, so how we can influence this in the wider public health. And as you know, in Europe, Australia, now UK, because we're not Europe anymore, of course, we tended to focus a bit more on a public health than some other countries, although we of course need to include the functional for our day-to-day interactions, etc. So the interventions that we tended to use was obviously building that understanding initially, getting them to really understand what health literacy was, and more than just this giving of information, etc. And then using a number of techniques to ensure that they try to improve the people that they served, if you like, or the people that they worked with, health literacy, whether that was in a secondary or a community type setting. So some of these that you can see on your screen now about teach backs and simple language, chunk and check, pictures, help with paperwork, etc. This is actually from Health Literacy Place. And if you go to that, which is NHS Education for Scotland run, all of these will lead to other resources that can be used with your students around these specific strategies, if you like. Also on our own health literacy page, there is some useful links that will take you out to other resources that you can use with your students. So from our point of view, what we do is tend to try and focus right from day one. So in the first kind of modules in first year, where all of our nursing students are together from all fields, so from child, mental health, adult and learning disability, to try to get them to focus on that. So we do a kind of health literacy lecture, which I tend to do, which leads them out to other resources. we tend to try to then embed that through all of the years, doing things around like, how would you think about health literacy when you were admitting a patient? How would you think about when you had to, do or create something around health promotion and then discharge, etc. Oh, somebody's got their mic on there. So also then thinking about how they would use that, or how they would think about access, understanding, appraisal, and then acting and using that information, whether it be in a digital component and round about their own digital capabilities, but also about their patients' capabilities. It's pretty unrealistic to not expect that patients will go and search for things on the internet these days. So obviously trying to get them to help how they would then signpost patients to trustworthy information instead of doing a kind of more scattergun approach, which, as you know, brings up information that often is not trustworthy and makes them quite confused, etc., or may lead them into information that's not exactly helpful. So some of the other stuff that we do is around the social models of health literacy, so to try to get them to think about the fact that obviously people don't tend to make decisions in a vacuum, and that they tend to make decisions by discussing it with other people, etc. So how, when we are discussing with patients in our kind of one-to-one, how that then impacts when they leave us and how that impacts their decisions. So there's lots of stuff that we do. We also incorporate a lot of free resources that are out there. So for us, it's about the NHS Education for Scotland's e-learning on health literacy, which gives them a good grounding for that. And we use that at a number of years and even in postgrad, because for us, some of our post-registration nurses have not always been to university, have not always seen this in their undergraduate education. So making sure that they kind of are introduced to that, regardless, not assuming that they already know about these concepts. The NHS Education for England have also accessed, I believe it's just basically they go to the same e-learning resource, or they've slightly adapted the Scottish resource, working with the academics who are working in librarians who work on the NHS Education for Scotland resource. One of the other things that we do in the first year is that we, once they've got these ideas around health literacy and they work out some of the strategies that you can use, then they do this kind of health fair, which obviously lets them really kind of get a good understanding about, how do you then make this information engaging? How do you make it accessible? Yeah, so there's accessibility issues that are brought up around how they design that information, and then they tend to have a stall when that included in their assessment as well. So it's quite a nice way to get them to start understanding these first principles about health literacy. Okay, so next, I'll pass over to Jo for this part.
Okay, so I'm talking here mainly about my role in Keele Medical School with undergraduate MBCHB, the undergraduate medical course. But before I talk about that in particular, I have also shared resources that I use with the undergraduate medical course with our School of Nursing and our School of Pharmacy. So as Evelyn said right at the beginning, though I'm talking about what I do, I know that across Keele that similar things are being undertaken in other faculties and other schools for other health professionals, and also the allied health professionals and the School of Physiotherapy as well. So in terms of just to chat about what I do here in undergraduate medicine, I deliver a health literacy lecture in the early years, much like Evelyn described, because we find that it's especially some of our students are straight from school, 18-year-olds, and it's quite a new concept, and it's not something that they've perhaps come across before. So they definitely need that foundations of health literacy early on in the course in order to be able to benefit from the later teachings as we go along. So that's the first stage, and then we develop them in terms of various scholarship activities over the course of the 5-year course. And one of the early things we do is they have a research project that they have to submit that is assessed, to do a literature review. A lot of there are many topics that they can choose, but there are several health literacy topics that they can do a literature review, for example, on the impact of health literacy on self-management of chronic disease. Various different topics within the choices for doing this literature review and writing an extended essay on. So that's quite good to get them thinking more broadly outside the sphere of just the one-to-one interactions with patients. There are also projects for them to write patient information leaflets and various other posters and things, projects like that, that we give them guidance on how to make sure about readability and accessibility and making sure it's understanding. Is there a word, understandability? But I think you know what I'm talking about. So writing for patients and public. We embed the notions of health literacy throughout the course in terms of low-hanging fruit. So if we obviously already teach communication skills, but our communication skills lead puts health literacy throughout the teaching of communication skills. When we're learning about more advanced communication in the later, more senior medical students and talking about shared decision making, we involve health literacy in there, because obviously it's not possible for a true shared decision-making consultation to go ahead if there's a problem with health literacy and understanding what the decision might involve. So we specifically include it in some topics, but we also try and thread health literacy throughout a lot of the curriculum. Health promotion, it definitely fits in there when we're talking about health promotion. And in prescribing, we know that the evidence is that a lot of prescription errors, and a lot of the reason why patients perhaps don't understand, or are unable to take medications is, well, one, because they've not had a proper discussion about the medication in the first place that has been health literacy appropriate and being able to understand the reason for the medication, and two, quite often the instructions medication use that we as health professionals distribute are at the very best confusing. I think there's an evidence somewhere that there are more than 57 ways to say take one medicine twice a day. So there's a lot to learn about prescribing and medication use. And then again, as Evelyn said, we talk to them about discharge from secondary care or at various points along the journey, the patient journey. So that's the various areas, or an overview of the various areas that we thread health literacy throughout the curriculum. We also include it with public health. Here in Keele, we have a public health BSc course, and I deliver similar level of teaching, the lecture and some project work to those undergraduates. And as I said before, it's included in undergraduate pharmacy and nursing degrees. So I think I'm handing back to you now, Evelyn.
Yep, thank you. So I think I've got, can you still hear me okay?
Yep.
A little signal that I've got low input audio or something. Okay, so to build there again on what Joe's just said, in our postgraduate qualified health professionals, as I say, who are coming back and studying part-time, it's quite interesting, and it can be quite daunting when we are doing, for example, diagnostic history taking, and I'm sure Joe would say the same when they're 4th or 5th year, and they have picked up, if you like, some maybe little bad habits, if you want to call them that, or just things because you do them every day and you kind of forget. So there does, when we're listening to them taking histories from each other, and one's playing the patient and one's playing the nurse or the HP or whoever taking the history, we have to kind of stop sometimes and be quite get the other person to be quite serious about how they say specific words. So if they are using a lot of jargon, you know, or if they're asking questions one right after the other, etc., and not giving time to, you know, think or answer, then we have to kind of pick that up. And that's quite difficult when sometimes you think you already know how to do these things. So it can be quite a delicate process to make them reassess their own kind of experience and how they do things. So that's quite interesting when they do stop and they see, actually, you know, I have just used this word or that word or whatever. And it allows us to get them to look at things, because lots of these practitioners will already be signposting people to places or using leaflets or these forms when you come into, you know, a department, say fill in this form, and making assumptions that people can actually fill in the form and can read it, etc. So there's things like getting them to reassess some of the forms and some of the leaflets that they use, to look at it in a different way and say, you know, how understanding is this really, and then trying to get them to do even audits with their the people that they're working with. And just as Joe said, for prescribing, so I was a module leader for the prescribing module for people who are not doctors, so nurses and allied health professionals doing prescribing. And exactly as Joe says, sometimes the idea is that you just need to be writing the prescription, and then when you realise actually you need to explain all these medications, and you know that explanation needs to be so that you actually are, you know, getting informed consent here. Because if you don't explain these medications correctly, then you're really not getting an informed consent. So this helps as well with the supported shared decisions. So there's some nice resources for this. There is a nice resource on Health Literacy Place around warfarin medication, and when a chap is taking a phone call around warfarin medication and hears what doses to give, and writes that in the INR 4.5 into the dose that he is to get, instead of the other way around into what the INR is. So it's a nice resource, and it's really quite interesting how the students are quite taken aback by the certain points in this scenario where errors can be made, and makes them really think about their own embedded, if you like, practice at the moment. So again, we would use a number of these kind of strategies throughout this module as well. We also, sorry, it's yourself first, and then me.
There you go. Yes, so I was going to talk about postgraduate and work we've done locally with qualified health professionals. Mike Oliver, who's on the course, he and I worked together with Stoke Public Health when there was such a thing as Stoke Public Health. I'm sure you'll ask Mike later about that. But we gave a series of talks, city hall talks or town hall talks, inviting health professions, or even not just health professions, if you use health in the broadest term. So we had their teachers and firemen and all sorts of people who might be at least involved in health in some way, and discussed the notion of health literacy and how we can all incorporate health literacy practices into our daily lives. And a couple of the results from that were, you see there a picture of one of our nurses in Royal Stoke University Hospital holding out leaflets about it's okay to ask. This was a project that Mike ran, that we encouraged. Encouraging patients to ask questions when they didn't understand by developing these leaflets, and nurses and health professionals in the hospital wearing pin badges that said it's okay to ask. Probably not allowed to wear the pin badges anymore, but hopefully the posters or that are still around to say that, you know, please do ask, and try and make sure we get a better health literate understanding within our healthcare professions. The picture down at the bottom right-hand corner there of a toddler in a dressing up box was another outcome of these town hall talks, where our speech and language therapists took it upon themselves to, knowing that in our area in Stoke we have language difficulties and more significant language difficulties in our population. We have a higher socioeconomic deprived population than many places. So they combined both encouraging toddlers to talk with encouraging them to learn about health literacy at a very early age by having, I think, 4 or 5 dress-up boxes and some vocabulary charts for the practitioners to have in the background, dressing up as nurses, dressing up as ambulance men, dressing up as firemen, and talking around healthy topics. So that was quite interesting. And also it has a side effect, if that's the right way to put it, of educating mums and carers at the same time and improving their health literacy. So that has been taken up very positively. And then Jill Rowlands and I don't know if Jill, you're on the call, but we worked with the Royal College of GPs to produce a document around health literacy and health literacy practices with all current practicing GPs, which you'll see there. That document was sent out to all of the GPs. So it's about raising awareness with practicing health communities in our hospitals, communities and GP practices in as many ways as we can. I still speak to GP registrars who are doctors, but in training to become GPs, and educate them as well about health literacy and making sure that they are practicing in a health literate friendly manner. I'm sure Mike will join the discussion a bit later about some of the other things we've done in Stoke if anybody's interested.
Absolutely. And exactly, that leads hopefully to the next slide, if I can get it to move again. Yeah. So, like I'm sure many of you, the SDGs are fairly embedded within GCU's themes for research. That's how we have decided to kind of base all of our research on, so they're around the SDG themes. So you can see here in 2017, this is quite a nice slide around how health literacy links to the SDGs. So we underpin where we can and encourage our students to do research. It's in and around us, as well as our actual researchers that are employed with the university. I mean, for me, although Dr. Jaka was, taking 1, 2, 3, 4, 5, 6, 7 of the SDGs. Personally, I think we can't really have any of the SDGs if we don't have improved health literacy. It really is fundamental for everything that's to do with health. Another thing that we do and have seen increased, as well as our own research. So people within the university who are employed as researchers doing more and more research around health literacy areas, although sometimes not flagging it at health literacy, it obviously is. We'll do, some of the formative type work for assessment around their kind of discussion or simulation. Within the simulation, we may stop at certain times and get them to think about how they've communicated, how they've tried to gain understanding, how they would then lead on to signposting people to information, etc., and how they would think about what that information is and how it's designed, etc. So the summative component then is that what we often use in health is an objective structured clinical examination. So we're really watching them during this exam to see how they've picked up, and actually are they doing it to a particular standard. For myself, there is, as I said at the start, when I started really talking about this, there was very few folk would raise their hand and even know what health literacy was. But now you can see in the written assessments, not just in my own modules, but in other people's modules, the discussions around health literacy, especially when there is kind of case studies that are based on real components of their interactions. We've also had an increasing number of empirical research dissertations. Myself, I've had about 4 different ones, one with in a kind of health visitors using food plates and then asking mothers to say how much food they would put on the plate for the children, and then getting engaging, understanding of health literacy before and then after that. I've had a few doing stuff around telephone consultation after COVID, so how advanced practitioners actually understand or can implement health literacy strategies, if you like, through the telephone, which is a bit different from what they were doing before, or using video consultation. So that's been quite interesting, seeing those dissertations coming forward, and a number of our students have now presented these at conference, which is great. And we're also seeing an increasing understanding of health literacy with each cohort. Thankfully, when I now say who's heard of this before I do any discussion around it, the hands are far more. So there's far less hands staying down than there was before, which is great for someone who's trying to champion this cause, obviously. So this is just a little whirlwind tour of what we're doing just now in our two universities, but obviously there's probably a lot more than what we've discussed before. Even things are popping in my head just now. But it gives you a little indication, and I see that there's some stuff getting put in there nice into the text, so great for sharing everything, folk. Anna, you want to take back over, and I'll just leave our information up there if you want to contact us at all.
Thank you, Evelyn, and thank you, Joe, for that really interesting presentation. I think it's really encouraging to see the breadth of work that's being done, and certainly you're two champions at the fore of health literacy work. I think it's clear from your presentation that it's certainly on the international agenda through the SDGs, and it's very relevant as a pillar throughout health promotion work, public health, within the research field, and certainly through your clinical teaching that you're providing to support individuals. I suppose my first question, and then I'll go through the questions that are in the chat and we can bring people in. How is this something that we could embed right across at a national level? So it's where there aren't current champions, that we can create them, and how do we drive it forward, that this is something that's on everyone's agenda and can be taken forward in the ways that you have demonstrated both at Keele and at Glasgow Caledonian University.
Jo, are you all right for me just to jump in there quick?
Okay, yeah.
I mean, certainly from our point of view, obviously Scotland having two health literacy action plans is helpful, because then they are used very much through, you know, all of our kind of health programmes, but also, and that tends to be across Scotland, I would probably say, and also in a realistic medicine. It's very much embedded in there as well. So all of these resources are very much used across a number of programmes in Scotland. So I think it probably is pretty much standard here, but how they get it right across the UK or more, who knows?
Well, I agree, but it's been a bit of a drip feed process in England. We've not been as good as you are in Scotland, that's fair to say. But at least the paper that Jill Rowlands and I'm not sure if Jill's on the call, but wrote back in 2015, where we demonstrated that health literacy was a significant issue across the population, coming up with those percentages that, you know, it's 43%, or, and if you include numeracy, it's up to 67%, or I may have got those figures the wrong way around now, but that are working age adults in the UK, which when you add it up comes to millions of people might be affected. That paper led to NHS taking it seriously, and now they have put it in their plans. They've included it on their website. It's mostly in shared decision making is where they've decided to place it. But at least now those figures are taken seriously, and across lots of policies now you're seeing health literacy being mentioned, which when I started in health literacy research years ago now, quite a long time ago, you never heard of it at all in England. When I would mention it, people would not know what I meant at all anywhere. But now it is on a drip feed way, it is becoming part of policy. And so once it becomes part of NHS policy, then it is easier to argue to include it into health professional curricula.
Mhm.
As they say with school teaching and educational curricula of any nature, shifting and getting things into the curricula is like trying to shift an oil tanker or turn an oil tanker. It's a very, very slow process. So my tip is to try and find areas in the curriculum, and there are many, many areas in the curriculum where health literacy is clearly part of it. And then, you know, like communication skills teaching in undergraduate medicine, for example, where they're practicing taking histories and talking to patients, then obviously that's an ideal place to put health literacy. So speak to the lead in whatever part of the course and say, you know, can we just tweak this a little bit? It's not a lot of extra work to just put a health literacy slant on things. That would be my tip for getting it into education.
Yeah.
Okay.
And can I pick up that question for Jan? Is that okay?
Yeah, let me just, I just stopped sharing your screen there.
Oh, that's her.
Yeah, so go ahead, Evelyn, if you can see the questions in the chat. Yeah.
So Jan, I think it was saying that she is a health librarian working in NHS Trust. Would you suggest we contact our universities and course leaders to whether we can provide any info on the topic? I would say, you know, or is this going to be addressed more strategically? So there is a lot of NHS Health England work being done on this. That one of the slides, Jan, that I showed you, where the health literacy e-learning thing was, there is loads of stuff on there. They're trying to kind of almost mirror what we've done in Scotland with the health literacy place, and I'm pretty sure that's pushed by health librarians. But Kirsten, who's here, who's on our steering group, will know that I just love librarians, you know, and I'm always saying they're so important for health literacy. So, you know, I definitely, because it builds absolutely on information literacy, which you are experts in. So if you've got resources, I don't think anybody would be turning down those, and would probably be happy for you to come and speak around some of them as well.
It's not a bad idea as a sort of, you know, like a political prompt. If you put in a freedom of information ask and said, can I ask you where you're addressing health literacy in your course? that might stimulate some people to go away and go, well, where are we and why aren't we? And quick, let's put something in. It's just a little gentle nudge.
Yeah,
it's probably a good idea, Jan. Sabrina, was it Jan? It was Jan that said, yeah.
So thank you for sharing, Joe, the paper there, the research paper, the link to it in the chat, and we can add any links as well to the website when it's included there. I suppose when you're talking about how important it is to have it in policy, it's worthwhile pointing out that we have a UK health literacy policy event coming up on Monday, the 14th of November, and it will be a hybrid meeting, so you can join in person or remotely via Zoom. So registration has been circulated out through the information service and also on Twitter. So please join that if you're available. It should be a very interesting event. We'll have the perspectives from the Four Nations on what's happening, but already from your conversation, I think it'll be great to have representatives from the Four Nations almost to say, well, what are we doing and how can we do it better? So a really good opportunity to have that discussion too. So someone saying in the chat there, we did a freedom of information study looking at respiratory care delivery and nurses. And I've just lost that message.
Yeah, and we had, just following on from what Nicola said, we had a freedom of information request to our medical school about what are we teaching on the menopause, which clearly is very topical at the moment, but it led to a high level flurry of activity from the dean downwards. So these things do put the, what's the word? Put the impetus into people.
Indeed, absolutely. And I mean, Nicola has actually just left GCU, which we're very sad about. And even just her work around this area has spurred on, folk to look at what is done in our undergrad and postgrad work. So yeah, I mean, strategically, it is brilliant if things are embedded into, policy, etc., and you can pull on them. However, I think making activities that are pretty real world, that the students can see the value in, really hits home where, health literacy is important, whether that's in the access, the understand, the appraise, or even the acting on and using phase of it. So if you even can, embed all of those across, but actually have activities that focus even down on each area, it can be very powerful for even people that have been qualified for a long time and practicing for a long time to reassess their own practice and say, you know what, that's exactly what I do. And now I'm starting to think about what have I, they get overly paranoid. Some of my students, they go, oh my God, what have I said to patients? And they've walked out and had no idea what I was talking about. And that's why 3 weeks later, they come back and they haven't taken their medication, or I realise they're not using their inhaler correct, or whatever else, because I actually haven't understood and checked their comprehension. And I've just assumed by saying, is everything okay? Are you happy with that? Yes. Which, as we know, doesn't quite work. So, interesting.
There's an interesting query from Eamon there about visual impairment, and I completely agree. Visual and hearing impairments, or any other disabilities, are often standing in the way of health literacy, but they're not part of health literacy. A visually impaired person can be as health literate as anybody else, but it can be a barrier to becoming more health literate. It's difficult to know what to do about this, but I suppose it's a broader question, isn't it, that any of our resources for teaching, learning, or patient or participant information should be accessible to anybody with a disability. And that's more than just a health literacy question, isn't it? But you're absolutely right, Eamon, it is a barrier, but it's a barrier to lots of things that we definitely need to address. I don't have a specific health literacy answer to that.
Yeah, Vicky is right about the Accessibility Information Act. And it's just like, when we put this out, we're hopefully we'll be able to get it subtitled and things like that. But as you know, the resources for doing that can be quite difficult, and the timeline to do that when you're doing this. A lot of this work is done on the side of the desk, but we do try our best to ensure that happens. From a university point of view, we obviously need to try to meet that. And again, the resources are offered. We have something like Blackboard. God, what's the word it's called now? What is it? Blackboard. To help me out here. Basically,
yeah. You often have, if you're using things like Teams, you can have, we've done it in some of our meetings, you can have the transcript, rolling transcript as people are talking. Absolutely. And that's quite useful for some disabilities as well.
Just not Collaborate, sorry, it's Blackboard, I can't remember what it is. Ali, that's the one. Thank you very much. Whoever rescued me, Julie.
It was Julie from UHI, no worries.
Aye, thanks, Julie. Blackboard Ally, where the students can change, obviously, the way that things are presented. And also, thanks, Julie. And, they can obviously alert us to their disability and then get adjustments made, etc. But from that overall question, as Jo has said, you're hoping that the designers are thinking about these things before they design the stuff, but unfortunately that doesn't always happen.
Not always the case.
Yeah.
I thought we were going to put cameras on so that we could be more chummy in this bit.
Yeah, we can put on cameras at this bit, absolutely. If anybody wants to, you don't need to, of course.
Okay, yeah, no.
Some of you might be in your pajamas. No, I'm sure you're all very... It's only what we can see at the top that matters.
I absolutely agree, Eamon. People with lived experience involving patients and public and participants in designing any resource.
Yeah, absolutely. And you can see, obviously, where that sometimes is not the case. Sometimes that's harder, believe it or not, in university when we try to get people involved. It doesn't always we don't always get as many people as we thought we would, but we definitely do have that as much as we possibly can when we're trying to design anything, you know, the curriculum even, etc. But yeah, for health information, it's amazing how many people forget to use even just everyday technology and make assumptions. So for example, the other day I was walking along, I met my neighbour who is about 84. She said she'd just been diagnosed with BPPV, so vertigo, and I showed her she couldn't do the exercises if she was given. I gave her the video to watch, a wee animation. She watched the animation. She looked it up herself on her phone. She used her Alexa to do the timings of how often she should move in her bed. So she shouted 60 seconds, Alexa, before she then did the turn, etc. So, you know, even if you don't understand what she's doing there, so instead of having a piece of paper that showed her little drawings and had words on it,
Yeah.
she watched the video as many times as she wanted and then used her Alexa to do the timings because she needed to do a specific timing before she moved her position. And that was the first time that the actual technique had worked.
And
So
bearing in mind, we're talking about educating health professionals and building skills in health professionals in this talk. What we, rather than just straight at patients, is we need to remind when we're teaching or talking to any colleagues, or we need to remind them about, if you are designing a patient information leaflet, for example, as well as using all the health literate practices that are taught, like checking the readability, the most important thing to do is to share it and get feedback from your intended audience, whether that's patients or members of the public or whoever it is. And I that's what I always tell my students, that you need to get some feedback from somebody who you are expecting to use your resource before you make it widely available. Because that's when you get the most sensible comments back, that you just gone away with some kind of high scientific principles in your head and forgotten the really basic things like you've just pointed out in your example, Evelyn. So that's the most important thing that we can teach our health professionals, is to think about health literacy. Yeah.
I think that was really clear during COVID, where we all needed new information quickly and it was constantly being updated. And I think you mentioned in your presentation those cues that we would naturally have around body language and the understanding of information when appointments went either by phone or virtually. We lost that. So we need to develop a new set of guides around communication and making sure it's taking place effectively. So those are really important to consider.
Yeah, it's great to see folks posting resources into the chat there. So that's really good. And we can maybe copy that chat and take some of these resources and see if we can stick them on our website when we get round to it, or even just look at each other's, you know, if you want to click some of these just now, then you might want to do that now before we shut down, and it'll allow you to open them up in your website, you know, your internet, so that you can maybe remember where they were. But we'll maybe try and add them to our website, but that might take a little bit of time.
And most importantly, that both Mike and Anne have put about the Health Literacy UK Policy Seminar, the link to that in the chat. So please copy that link before the chat gets closed.
Yeah, we can save the chat.
Yeah. So I'm going to just do that exactly right now. I'm running up this to get all of these resources and get them to open up in my
We also have one more seminar in the series. It's next Tuesday at the same time, and we'll have Jane Hotley from Derbyshire Public Health talking about her experience with health literacy at local government level. So you're very welcome to join, and you can register for that event. If anyone has any questions that they would like to unmute and ask, you're very welcome to, or continue to put questions in the chat. I think we have clicked back over most of them. Or if there are no other questions, let me see.
10 minutes to grab a coffee before the afternoon starts, which just sounds like perfect timing to me.
Yeah, Yeah, so some people beginning to leave. Apologies, people have to go on. So maybe that's a good time just to close up. So thank you again to Evelyn and to Joe for your presentation. Really interesting and to share your approaches, and also for us all to think about how we take the topic forward and continue to highlight the need for health literacy. The recording will be shared on our website in the coming weeks. And there's also an opportunity to join next week for the final webinar, and then again in November, either in person or virtually, for the health literacy policy event, which will have keynote speaker Dawn Nutbeam, and also then presentations from the 4 nations. So a really broad perspective on what's happening, and lots of ideas and inspiration to take forward health literacy. So thank you for joining. And you can get in touch directly with our presenters or with Health Literacy UK if you have any further questions.
Yep, thanks very much, everybody. Great.
Thanks for coming.
Yep, thanks.
Bye.
Bye.